So you need emergency Suboxone. Let's talk about what you can do. If you're already prescribed Suboxone or another buprenorphine medication by a healthcare provider, then obviously this is your first resource. So an ounce of prevention here. Do your best to make your appointments and meet any other treatment requirements like urine testing so that you can get your buprenorphine medication in a consistent and timely manner. But no one likes to be lectured. You already know this. And we all know that in real life, things happen. Life doesn't go as planned. And you're running out of your prescription for a number of reasons. And it might not even be your fault. You just need buprenorphine ASAP because you don't want to risk returning to opioid use or getting sick with opioid withdrawal. First, you can usually get a bridge prescription from a provider at the emergency department. Federally, there is this 3-day rule where a provider at a hospital or emergency room or jail can administer buprenorphine for up to 72 hours or 3 days. But there may be other restrictions based on your state's laws and your local emergency department's policies. There's also some good news. Last year, on December 29, 2022, President Biden signed the Consolidated Appropriations Act of 2023, which eliminated the X waiver, meaning all healthcare providers who are registered with the DEA can prescribe Suboxone if they have completed some training requirements. Before this bill, there were about 100,000 X waiver doctors in the US who could prescribe buprenorphine for opioid addiction. And there are about 1 million licensed doctors in the US. So theoretically, there are now 900,000 more doctors out there who can legally prescribe Suboxone. And that doesn't include nurse practitioners and physician assistants. But in reality, many providers are unfamiliar with Suboxone, or they may carry some stigma or bias around opioid use disorder, and they might not be willing to prescribe buprenorphine for addiction treatment. If you're not sure where to turn, you can start with findtreatment.gov to find an opioid treatment program or a buprenorphine practitioner. That being said, we know that getting an appointment to see a medical provider can take weeks. And again, you can go to the closest emergency department for a short-term bridge prescription. You can also consider care here at Bicycle Health, where we can aim to get patients an initial appointment within 48 hours, and our support staff can connect you to a pharmacy with buprenorphine in stock.